Good day! This is JHUCYL, and I will be discussing about bronchitis, more focusing on acute bronchitis. Are you ready to learn with me? I guess it's a yes. So, let's get started. Bronchitis. Bronchitis is an inflammation of the mucous membrane in the bronchial tubes, which causes coughing and often with mucus. Bronchitis comes in two types. First is the acute bronchitis, which is also known as a chest cold. It is a form of lower respiratory tract inflammation affecting the air tubes or the bronchi of the lungs. It usually comes on suddenly and can last for only 3 to 10 days. Most people with acute bronchitis recover after a few days or weeks. Viral infections such as the cold or flu are usually the cause of acute bronchitis. Occasionally, acute bronchitis can be caused by a bacterial infection. People with recurrent acute bronchitis may develop the second type of bronchitis, which is the chronic bronchitis. Chronic bronchitis is an ongoing cough that lasts for several months and comes back 2 or more years in a row. The cough is productive, meaning it brings up mucus. In chronic bronchitis, the lining of the airways is constantly inflamed. This causes the lining to swell and make more mucus, which can make it hard to breathe. Chronic bronchitis is often part of a serious condition called chronic obstructive pulmonary disease or the COPD. Pathogenesis. The pathogens causing the disease such as rhinovirus, coronavirus, influenza virus, and respiratory syncytial virus will enter to the mouth or nose, which results through irritation of the airways and leads to inflammation. Inflammation results in hypersecretion of mucus in the bronchial airways. The cough reflex aids in the elimination of mucus secretions from the airways. In time, bacteria can colonize the damaged airways, causing the sputum to be purulent. If the patient is healthy, the viral infection is eliminated and the mucous membranes return to normal within 7 to 10 days. Mucociliary clearance of the airway may be delayed in patients who smoke or who are exposed to smoke because of excess mucus production and loss of ciliated cells, which leads to a productive cough. For acute or chronic bronchitis, signs and symptoms may include cough, production of mucus or sputum, which can be clear, white, yellowish gray or green in color. Rarely, it may be streaked with blood, fatigue, shortness of breath, slight fever and chills, and chest discomfort. If you have acute bronchitis, you might have cold symptoms, such as a mild headache or body aches. While these symptoms usually improve in about a week, you may have a nagging cough that lingers for several weeks. Chronic bronchitis is defined as a productive cough that lasts at least 3 months, with recurring bouts occurring for at least 2 consecutive years. If you have chronic bronchitis, you're likely to have periods when your cough or other symptoms worsen. At those times, you may have an acute infection on top of chronic bronchitis. Medical management. Acetaminophen is used for the relief of cold symptoms such as fever and pain. Analgesic and antipyretic agents may be used to treat associated malaise, myalgia, and fever. Antitussive agents like dextromethorphan, codeine, or guaifenesin is used if cough is interfering with sleep, and also if cough persists for greater than 2 weeks. It is to suppress the cough. However, there are no randomized trials exist to evaluate their effectiveness in acute bronchitis. Acute bronchitis should not be treated with antibiotics because the symptoms are usually caused by viruses. Antibiotics don't help much in the treatment of acute bronchitis, but they can have side effects and contribute to bacteria becoming resistant. Treatment modalities. Smoking cessation and the avoidance of allergens and pollutants play an important role in the avoidance of recurrence and complication. Promoting hydration such as the non-pharmacological therapy, which includes hot tea, honey, ginger, and throat lozenges. However, there are no clinical trials evaluated in the efficacy of these interventions. Also, using a humidifier or a steam, in which a hot shower can be great for loosening the mucus. Diagnostics and laboratory procedures. Chest X-ray may reveal intensive pathologic process in the lungs. It differentiates pneumonia from acute bronchitis when infiltrates are seen. Complete blood count and chemistry may be ordered as a workup for fever. White blood count might be mildly elevated in some cases of acute bronchitis. Blood chemistry cannot reflect dehydration changes. Spirometry, when performed, it demonstrates transient bronchial hyperresponsiveness in 40% of patients with acute bronchitis. Airflow obstruction and bronchial hyperresponsiveness typically resolves in 6 weeks. Nursing diagnosis includes ineffective airway clearance related to collection of mucus. A nurse would teach the patient for the proper ways of coughing and breathing. An example for this is taking a deep breath, hold for 2 seconds, and cough 2 or 3 times in succession. Next is to position the patient upright if tolerated. Regularly, check the patient's position to prevent sliding down in bed. And also, make sure to give the medications as prescribed. An example medication is mucolytic agents, bronchodilators, expectorants, and also, take note for the effectiveness and side effects. Another nursing diagnosis is ineffective breathing pattern related to bronchitis, as evidenced by the presence of cough. A nurse would assist and demonstrate proper deep breathing exercises. Also make sure to maintain a clear airway by encouraging the patient to mobilize own secretions with successful coughing. Make sure also to provide humidified oxygen via face mask, hood, or tent, or any appropriate oxygenation devices. Patients with acute bronchitis have a good prognosis. Bronchitis is almost always self-limited in individuals who are otherwise healthy, although it may result in absenteeism from work and school. So let's have a short recap. What do you call a condition in which there is an inflammation of the bronchial tubes? Correct! Bronchitis. Acute bronchitis could only last for 3 to 10 days. And when it lasts longer, it is called chronic bronchitis. And it is commonly caused by viruses, so taking of antibiotics are not usually prescribed. Smoking cessation, avoidance of allergens, and pollutants are the ways that could help you manage and treat the disease. Chest X-ray, spirometry, and CBC are procedures that could help diagnose a patient with bronchitis. And that's all for my discussion. Thank you for watching. Goodbye!